Ladies and gentlemen, welcome to the English Daily Book Summary YouTube channel. In order to not stop learning, listen to an English book summary every day for free.
Malcolm Gladwell, Revenge of the Tipping Point, Overstories, Superspreaders, and the Rise of Social Engineering. Why do some ideas spread like wildfire, while others fizzle out? What explains the sudden, seemingly inexplicable popularity of certain sneaker brands or food trends? Why does crime plummet in one city and skyrocket in another? Malcolm Gladwell has a compelling answer: that social trends are a lot like health epidemics. In other words, if we want to understand virality, why not look at actual viruses? That, in a nutshell, is the idea we'll be exploring in this blink as we connect the dots between bank robberies in Los Angeles, tonsil-removing doctors in Vermont, vaccine-skeptical schools in California, and a COVID mass infection event in Boston. Together, these seemingly unrelated stories will reveal the patterns behind how influence spreads, how social contagions take hold, and why certain movements thrive in specific environments. By the end, you may start to see the hidden architecture of trends forming all around you, and the tipping point that sparks the next big thing. Stick-up fever. On November 29, 1983, the FBI's Los Angeles field office received 6 phone calls reporting 211s, the bureau's code for bank robberies. The suspect in each holdup was a slim white male with a southern accent wearing a Yankees baseball cap. Agents recognized the description. It was one of LA's most prolific robbers, a man they called the Yankee Bandit. He knocked over 6 banks in 4 hours that afternoon, a new world record. Criminals like the Yankee Bandit weren't supposed to exist anymore. Robbing banks, a definitive 1968 study of the subject concluded, was a thing of the past, akin to cattle rustling. Banks were more secure than ever, and few crimes had higher arrest and conviction rates. Only a desperado with nothing to lose, that was the study's title, would contemplate trying to rob a bank. It was too much risk for too little reward. The study couldn't have been more wrong. By the 1980s, there were 5 times more bank robberies than there had been in the 1960s. Some years, the FBI registered close to 10,000 211s. One city in particular was at the center of this extraordinary crime wave. In the mid-1990s, when that wave crested, a quarter of all bank robberies in the U.S. were carried out in LA. The longer it lasted, the worse it got. In the early days, robbers stood in line waiting to pass the teller a note saying they had a gun, and then grabbed whatever cash was on hand. Second-generation Angelino robbers didn't say please or thank you like the Yankee Bandit. They came in hard, assault rifles blazing, ignoring the teller's drawers up front and forcing their way into the high-value vaults in the back. Heists were more violent and more lucrative. Suddenly, crews were netting millions. That got people's attention. The most enterprising second-generation bandit was a 23-year-old named Robert Sheldon Brown, also known as Casper. In just 4 years, Casper hit 175 banks, a new world record. Casper inspired dozens of copycats. By 1992, the city was averaging a robbery every 45 minutes during banking hours. Robbing banks was a social epidemic, but it wasn't a mass participation event. It was driven by a small number of atypical individuals who did one job, and then another, and then another. Bank robbing was like a disease, but it only needed to infect a few people to tip Los Angeles into mayhem. Epidemiologists have a good word for contagious individuals like the Yankee Bandit and Casper. They're superspreaders. Small area variation. Epidemics are contagious. They spread across city boundaries, state lines, and national borders. Give a virus in Wuhan, China a couple of weeks and a few international airline tickets, and it'll soon be infecting people in Paris, New York, and Tel Aviv. So here's our first puzzle. Why didn't the bank-robbing fever that gripped LA spread to other American cities? One part of the answer to that question takes us to New England. In the late 1960s, the U.S. government program to improve medical provision hired a young researcher to map the quality of healthcare across the state of Vermont. John Wenberg divided the state into 13 districts and calculated how much each district spent on medical care. Wenberg assumed he'd find a simple pattern: higher spending in affluent areas, lower spending in poorer areas. What he found instead was a variation that didn't fit any pattern. Vermonters in one district were 3 times more likely to have their appendixes removed than peers in the next. In a town called Stowe, 70% of kids had their tonsils removed. In Waterbury, a near-identical town 10 miles down the road, it was just 20%. Wenberg found the same patternless variation, he called it small area variation, all across the United States. What accounted for it? One early theory was that different patients have different demands, but subsequent research suggests that what doctors want to do matters more than what their patients want them to do. It's not a question of money either. Whether wealthy people with insurance plans that reward aggressive treatment have their appendixes removed mostly depends on whether they live in appendix-removing districts or not. Nor is small area variation random. If it were, you'd expect to find a doctor who always takes out tonsils, another who rarely does, and a third who falls somewhere between her colleagues in every hospital. That's not what Wenberg and later researchers documented. Their work shows that hospital districts develop common identities. Which treatment doctors prescribe is largely determined by where they live and work, not where they all went to medical school or what kind of person they are. It's like there's a contagious idea in the air, some kind of mind-altering virus that rips through one hospital without ever infecting the next. Maybe idea isn't the right word. It's more of a story, the kind of story people tell each other about themselves and their communities. We'll come back to that. First, let's take a look at another case of small area variation. Overstories. California maintains a public database of vaccination rates in its middle schools. Most kids in most public schools, it shows, are fully vaccinated against infectious diseases like measles, mumps, and rubella by the time they reach 7th grade. It's the same in the private system, with one exception: Waldorf schools that apply the holistic learning philosophy of the 20th century Austrian educator Rudolf Steiner. On average, Waldorf pupils are 65% less likely to be vaccinated than their peers in other schools. The simplest explanation is that vaccine-skeptical parents seek out like-minded educators. But that's not what's going on, according to Elisa Sobo, an anthropologist who has spent years researching Waldorf schools. Sobo argues that parents pick up opposition to vaccination from the schools themselves. Her work documents a pattern among parents with multiple kids enrolled in Waldorf schools. Each subsequent child receives fewer vaccinations than the last. Earlier, we mentioned the stories people tell about themselves and their communities. Call them overstories. An overstory combines all the assumptions, prejudices, fears, and desires that holds a community together and shapes its members' behavior and development. Waldorf schools have a powerful overstory. Pick up one of their brochures or watch one of their promotional videos, and you'll see its outlines. It goes like this: Our schools teach kids how to learn. It doesn't pack them into boxes or fill their heads with pre-digested facts. It encourages them to find their own answers. To belong to the Waldorf community is to be surrounded by people who are curious about and question everything. Most parents couldn't tell you precisely how vaccines interact with their children's immune systems, but they don't need to. Parents who vaccinate kids are people who defer to the judgment of medical experts. The Waldorf overstory, by contrast, primes parents to question consensus views and reach their own conclusions about complex subjects. It's relatively easy, then, to connect the dots between Austrian pedagogy and Californian vaccination rates. But there's a wider lesson here. Social epidemics have two components: a virus, and an immune system. There's the contagious idea that says you have to remove tonsils or that it's a good idea to rob a bank. In epidemiological terms, that's the virus. But these ideas don't infect everyone. Vaccine skepticism thrives in Waldorf schools for the same reason that the bank robbing fever gripped LA. These places' overstories, their metaphorical immune systems, made them uniquely receptive to these bugs. The virus that went nowhere, and the one that went everywhere. January 2020. A student at the University of Massachusetts returns to the US after spending the holidays with family in Wuhan, China. He lands at Logan Airport, waits for his suitcase in the crowded baggage claim area, stands in line at immigration with hundreds of others, and finally boards a packed bus heading downtown. No one's wearing a mask or social distancing. Looks like a public health disaster in the making, but it's not. Boston's first documented case of COVID hits a brick wall. The student doesn't infect anyone. The virus fails to spread. By February 2020, there are 120 unique strains of COVID in the Boston metropolitan area. Most fizzle out like the students. Even ultra-virulent strains are strangely self-contained. One of the worst ravages a nursing home, killing 24 residents, but then it stops. Epidemiologically speaking, these strains fail to cross the threshold known as a tipping point, the moment a virus becomes self-sustaining and explodes into widespread infection. Only one outbreak tips during these early months of the pandemic. On February 26, 2020, Biogen, a Massachusetts-based biotechnology company, holds its annual leadership retreat at a Boston hotel. Spirits are high. The company's had a good year with profits and earnings both up. Employees from dozens of regional and international offices land at Logan. They shake hands, hug, talk, and laugh in congested dining rooms and foyers. The next day, they head back to the airport. Planes carry them to Florida, North Carolina, Sweden, Slovakia, Australia, and 29 other locations. This time, there really is a public health disaster. An infectious disease specialist named Jacob Lemieux heads up a team tasked with investigating the fallout. The COVID cases that are documented after the Biogen meeting all have a distinctive genetic signature, a mutation called C2416T. Lemieux traces the path of what's soon being called the Biogen strain around the world. The scale of the disaster is breathtaking. 300,000 infections. And here's where the story gets even crazier. Lemieux and his team are convinced that every single one of those 300,000 infections can be traced back to a single individual they call the index case. Brings us to our final puzzle. What made Mr. or Mrs. Index so special? The law of the few. Aerosolists, scientists who study air droplets, can help us answer that question. Before we talk about viruses, though, we need to look at cars. In 2006, Donald Stedman, an aerosolist at the University of Denver, set up a self-made contraption on the side of a highway. Stedman's device used infrared light to instantly measure and analyze the emissions of passing vehicles. If they were fitted with the correct pollution control equipment, the word "good" flashed up on a screen. When a heavy polluter sped past, the word "poor" appeared. Stedman's study reached a startling conclusion. Just 5% of the vehicles on Denver's roads were responsible for 55% of all automobile-produced pollution. Researchers in other cities and countries later repeated Stedman's test. Their findings matched Stedman's. A small minority is invariably responsible for the majority of automobile-related air pollution. Call it the law of the few. A small number of people causing a big problem. We've already seen that law in action in Los Angeles, where a few exceptional robbers knocked over a lot of banks. The Biogen case is another example. Put simply, the way airborne viruses spread is this. When we talk, our vocal cords slide open and shut like pocket doors. When they open, a string of fluid forms between the two cords. When they close, that string snaps and bursts into tiny drops of saliva called aerosols. When we exhale, we expel millions of these aerosols, each one of which can carry virus particles. Once scientists figured out that COVID was an airborne virus, they faced a quandary. If all it took to spread the virus was people talking and breathing, why weren't there thousands of cases like the Biogen mass infection? Enter Dave Edwards, a researcher at Harvard. When Edwards measured the aerosols emitted by 194 people talking at normal volume, he found significant variation. The majority produced very few aerosols. A small minority, just 18 participants, produced a lot. The top 2 emitters, meanwhile, produced 20 times more aerosols than the average participant. The final piece of the puzzle emerged in 2021, when British researchers deliberately infected 36 volunteers with COVID. The participants, who were all young and healthy, received identical doses of the same strain of the virus and were held under identical conditions. Close to 90% of all COVID particles detected in their group could be traced back to just 2 people. There's the law of the few again, and the answer to our earlier question. What made Mr. or Mrs. Index so special was their unfortunate ability to produce prodigious amounts of virus-laden aerosols. We still don't know exactly why superspreaders do this. It could be a quirk of their saliva or some other genetic factor, or it might have more to do with things like weight and age. But we will know very soon. By the time the next pandemic rolls around, we'll likely have tests that instantly identify 99th percentile aerosol producers. Will governments and their teams of social engineers be tempted to proactively isolate superspreaders? Maybe. How that urge squares with the norms and laws of liberal democracies remains an open question. In this blink to Revenge of the Tipping Point by Malcolm Gladwell, you've learned that social epidemics, like biological ones, are driven by superspreaders. While the latter spread contagious pathogens, the former spread contagious ideas. How far they spread depends on how receptive communities' narratives about themselves are to such ideas. Whether we're aware of it or not, each of us is part of a larger network that drives ideas toward their tipping points. From cultural trends to social movements, recognizing and understanding these tipping points early can help you seize opportunities, navigate challenges, and maybe even become a catalyst for change. Okay, that's it for this blink. We hope you enjoyed it. If you can, please take the time to leave us a rating. We always appreciate your feedback. See you in the next blink.